would you say that we should not have indoor dining, even going into the winter?
Yeah, absolutely.
The difference between this vaccine and the polio vaccine, correct me if I'm wrong, is that those vaccines which are required do prevent outbreaks of that disease.
I'm not really that concerned about vaccine mandates. I'll be honest.
I don't have a very high opinion of the public health epidemiologist expert community.
Does it concern you to have a policy like this in place that is not really that geared toward preventing the spread of a virus, but could have the effect of limiting kids' access to education?
I don't believe that as a society, we should just sacrifice people who are vulnerable, who are elderly.
Do you think that there is a legitimate public health rationale for vaccine mandates?
Yes.
DC schools, obviously most schools have made a different calculation, but DC schools they have this vaccine mandate. There is evidence that disproportionately Black and brown kids are not vaccinated. Some numbers say 40% of Black kids wouldn't be able to start school if they keep this mandate in place. We do not have the new vaccine that guards against Omicron and perhaps prevents the the transmission of the Omicron virus, which I would argue would militate in favor of vaccine mandates to the extent that you support vaccine mandates. But given the kind of civil liberties implications of this, of any mandate, and also given the disproportionate effect on populations that are already underserved by the educational system, does it concern you to have a policy like this in place that is not really that geared toward preventing the spread of a virus, but could have the effect of limiting kids' access to education?
Well, we also know that Black and brown families overwhelmingly were more in favor of remote schooling options and, pandemic mitigation measures in schools generally. It is true that there is vaccine hesitancy, but that initially it was pretty heavily in the Black and brown communities, but that has sort of, I think, become less prominent. Like that difference has become smaller over time. It does concern me that there is sort of, I'm not really that concerned about vaccine mandates. I'll be honest. I think it's just
why?
Because we require things like the polio vaccine for public schools. Like it's very, very basic stuff. Like what is different about this shot from that shot? We know that this is a safe, effective way to prevent severe illness and death. I'm talking to
respond. Go. Sorry, finish your point.
I'm talking to a mother right now for a podcast that I'm working on about COVID, who lost her 10-year-old daughter, who could not get vaccinated. The healthy 10-year-old girl died in 5 or 6 days. Like that outcome is so, it's so atrocious and so repugnant to me. I think that at a certain point, people's hesitancy, it just requires leadership. It requires federal leadership.
I mean, the difference between this vaccine and like the polio vaccine, correct me if I'm wrong, is that those vaccines which are required do prevent outbreaks of that disease, whereas this vaccine, unfortunately, does not. And I wish that it did. So unlike these other restrictions we're discussing, I don't find the vaccines to be a problem. So I'm vaccinated. I advocate for people to get vaccinated. I don't have any problem with vaccines or vaccination. That's the decision to get vaccinated seems to me like a good one for a whole lot of people. But and I don't have kids. If I had them, I might vaccinate them. I would certainly talk to a doctor. I think it's the right choice, probably for a lot of families and a lot of young people, certainly young people with underlying health conditions. So I'm not discouraging vaccination whatsoever. And if it was the case that by vaccinating kids at the school, you were going to have a significant less likelihood of an outbreak of COVID in the school, that would be a pretty compelling argument. You're right. We do require vaccination for schools. I think that would be a pretty compelling effort to do that. Early on, when vaccines were coming out, unlike other restrictions, I was more theoretically, at least philosophically, okay with a vaccine mandate under certain circumstances, because we do have a history of requiring, constitutionally, it's stood up. Now, I disagreed with Biden himself just declaring it for all federal workers without any new law or anything like of that nature. But look, I get the rationale for it. I think you could have made a case for it if it was keeping down transmission, but it's just not. Given that the main effects of the vaccine is to prevent you, an individual, from a severe bad outcome of COVID, I don't see what the justification can be for requiring it of other people, especially, again, of a population that is not very likely to have a severe outcome anyway. If it was doing something significant on transmission, I would totally understand putting that calculus the other way. I really wish it kept transmission down. I do. I wish it was the way it was in the beginning. Was
Robbie,
90%.
have you talked to many healthcare workers who've had to deal with kids in the ICUs and whatnot?
I've
preventing severe illness and death is definitely a net benefit.
But Walker, here's the thing. Like I'm very sensitive to that as well. But is there not a difference to you? Like, so what I hear Robbie saying is, if this new Omicron vaccine comes out and it actually prevents Omicron, which is the predominant strain right now, from being transmitted to folks, he might actually support a vaccine mandate for schools or more broadly, But in lieu of that, do you not think that there's a difference, Walker, between something which is like a true vaccine that prevents the spread of illness, like no one's getting polio, no one's getting meningitis if everybody gets their vaccines, and something like COVID, which I don't know what the numbers are, maybe you do, Walker, but at this point, getting vaccinated, while it absolutely protects you, the individual who's vaccinated, from the worst effects of COVID and hospitalization and such, it doesn't really keep me from spreading it to someone else once I get it.
That's true. It definitely, vaccinated people can get the virus and they can spread the virus. And we do know that. But there is still a preventative effect of these vaccines. Again, there have been several variant waves from the one that these vaccines were designed to protect against. However,
how low does that protective effect have to be? Like,
other
this
vaccines,
is the question.
no, there's no perfect vaccine that's going to prevent everybody all the time from getting the illness. I think this has been sort of touted like, oh, these vaccines are leaky and therefore we can't require them. No, I don't agree with that. I think that these vaccines have been shown to be safe, effective at very effective against preventing severe illness and death. We should probably open up for more boosters because people are out of date. We know that protection wanes, but I don't think that the difference between the polio vaccine and the COVID vaccine is as stark as Robbie is painting it. And I do think that transmission is not the only issue. I think that making sure that pediatric ICUs have beds is also an important consideration. Making sure that our healthcare workers aren't overwhelmed, that they don't, doctors are trained to deal with suffering and seeing suffering and death. But when you see so much of it, I've talked to doctors who are pretty overwhelmed with the amount of suffering that they've seen. And I think that is a consideration as well.
So Walker, if the issue is that we don't want our healthcare system to be overburdened, I can think of a couple of ways to go about that. For one, I'm loving some student debt cancellation so that we can have more people who are.
Oh, Briahna, we can't do that again this week. I don't have it in me. Oh,
we can always do student debt, but I'll get off it, Robbie. I'm just touching on it to say that, of course, we have deficits of public health practitioners, and we need more people trained and willing to do that, especially since it is such a tough job and people are suffering such burnout. Two, I think that the government has really slacked in its kind of public campaigns to encourage people to get vaccinated and to make it easy to get vaccinated. So I would very much encourage if the DC government set up vaccination centers on the first day of school or in the week leading up to the first week of school, letting parents know that they can get their kids' vaccinations up to date if they want. It's free, it's public, it's right there, it's safe, it's good. Just for my own personal kind of libertarian socialist interest, am not wild about anything that's mandated at the same time that I very much want everybody to do it. And so I'm always thinking about what carrots exist as opposed to sticks to encourage people to go ahead and do it without having to actually force them to. And I do think that you can get into a world where mandates are potentially necessary when the public health interest is so big, when the death toll of something like a meningitis outbreak or polio outbreak is so significant. But I do think that sometimes libertarians like Robbie have a point when they say if the effect of getting the vaccine is so individualized and personal, it protects you, doesn't that chip away at the public health argument toward forcing people to get it? If someone doesn't want to be healthy and happy, then that's on them. And I hear your point about the hospitals. I do think that it is a good one. But are we experiencing ICU, pediatric ICU overload right now? Or do we anticipate it happening in the fall when schools open?
In some places around the country, yes, we are seeing high pediatric ICU usage, I guess. But yeah, I mean, look, this is a problem with each of these COVID waves. You put immense strain on the healthcare system in the immediate. Then you have problems of long COVID in the future that we're going to have to deal with at some point. I mean, I know that you are a fan of single payer. I think that is the only way that our healthcare system is able to handle a crisis like this. But in terms of the protective nature of the vaccines, I think that the longer we take to vaccinate, the more this virus is going to mutate, the more it's going to spread. And frankly, that is a problem. It's not just here. It's internationally. The people who are sort of vaccine hesitant, let's call them, or people who say like, oh, you've bought into propaganda from Pfizer. It's like, well, where do you stand on like releasing the vaccine IP and trade secrets? Like, tell me how you feel about that, because if you don't support that, then you happen to be on the same page as the biggest pharmaceutical companies in the country.
I am, by the way, not hugely so in favor of like intellectual property and things like that. I think it is excessively. Our law protects it excessively to the benefit of drug companies and not the pub. And even from a libertarian perspective, libertarians, obviously, right libertarians, my kind of libertarians, are very property is very important. Patent and copyright are not, to my view, are not property in nearly the same way. And so I would not necessarily disagree with you, even from my perspective, on those things. I just wanted to.
I mean, I think it's also it's also important that like this is not an academic exercise. What we're dealing with is not like there is a real human cost to not taking certain steps, and I don't think that cost is being effectively communicated to people anywhere. I mean, really, the only person on cable news who I see talking about this is Mehdi Hassan.
We can always we could reduce the speed limit to 5 miles per hour. There'd be fewer car crashes. We can always.
But we're not even doing the equivalent. We're not even doing the equivalent of imposing a speed limit, right? Like we are completely. We are open. I mean, if you're a worker and you get COVID on the job, you have no recourse. You don't have paid leave. You don't have a healthcare system that is there to catch you. And if you get sick, you lose your wages, and that's that. And you might end up severely ill, in which case, whether or not you'll be able to get disability is up in the air. Who knows? I mean, we don't have even basic measures in place right now. Would you agree that we should have in a historic pandemic like this that's killed more than 1 million people, that we should have workplace safety standards across workplaces so that people are protected?
I mean, we do have workplace safety standards. I mean, maybe they should be different. I feel like that's a little bit of a different conversation. I wanted to go back to Briahna, what you said a minute ago about what carrots can we use if we want to incentivize vaccination. I'm sorry, but one of the best ones was easing up the other restrictions. You that was a kind of implicit thing. Get vaccinated so that we can go back to normal. So you can see people again. You can go back to school. You can go back to dinner. You can not wear a mask anymore.
Yeah, Robbie,
that was like an implicit thing, and that might be.
Work. But that doesn't work when we have these new variants where the vaccine doesn't protect you. I mean, that was true of that first summer. Last summer, I was wiling out. We were all having hot girl summers. And by wiling out, I mean eating at outdoor dining establishments. That's not something I was doing before. I'm still
having hot girl summer, Briahna.
But look, it doesn't feel so hot.
She looks at me like Typhoid Mary every time I come into
I literally call Typhoid Mary every time he coughs on set.
I mean, in your defense, I had bronchitis for weeks. I have been sick.
Yes, Robbie, you're always sick. You're
I've
always
had a
sick.
bad summer. I've had a bad summer, but it wasn't COVID. It was just I was
Right,
just sick.
but
People get
but Robbie,
sick.
but that's the thing. Like you're the argument you make, Robbie, is like how this can't last forever. What are we going to do? These interventions don't make sense. I've had the opposite experience with doing COVID interventions where I was someone who was frequently sick. My mom is always like, Briahna, you're sick from like September to March every year. Since COVID has been around and since I've been masking and actually washing my hands instead of doing what I used to do, which was lift to a restaurant, touch the door to the lift, touch the door to the restaurant, touch the door to my apartment building, and then sit down at a table and immediately start eating French fries with my fingers. Now I don't do that anymore. I wash my hands. I use, alcohol spritzes and whatever, and I don't get sick anymore. And so my thought was, oh my God, we should have lowered the speed limit. We should have always had masking in these protocols because it actually has made my life better.
I followed the stuff. So until vaccination, I was much better behaved. I did, maybe it wasn't to your level, but much more minimal socializing or only outdoor socializing. Yes, I did. You had to wear a mask in my apartment building. I hated it, but I did it, etc. Until the general easing up after vaccination. I was just as sick as I was at any other time in my life. It did not work for me. That's just anecdotal experience. Didn't do a thing to help me. But
look, I think, first of all, the hand washing, that's great. I keep the alcohol spritz as well. I mean, now with monkeypox as well, everything is, ugh. But look, we're heading into a world that is, with climate change, we're heading into a world where we are going to be dealing with major crises that require more of a response than make your own decisions. It's up to you. Speed limits don't prevent everybody from speeding, but they do set a general speed for the highway. You're not going to see many people blowing 100 in a 55 or 70 in a 25. Like there is a policy does affect how society operates. And that's the kind of thing that we have to keep in mind as we face a pandemic like COVID.
But that wasn't exactly my point. I was saying that if we lower, you could always improve, you could always have some improvement of safety with an even lower speed limit. It's just, but what is the trade-off? Are we make everybody, a third as productive because it takes longer to get what are the...
Okay, I apologize if I misunderstood your point. Can I ask you how many deaths then is an acceptable number for sort of normalcy?
Well, we're trying to weigh how much more does this intervention help? How many fewer deaths are we preventing? How much less disease will we have? And then what are how practical are these interventions? How annoying are they? So we're trying to weigh all those things. And reasonable people draw different lines, but a lot of people, myself included, are at the point where, especially for the population we were talking about when we started off the discussion, the least vulnerable and the least compromised, that having restrictions on them, especially restrictions that are more vast, just make utterly no sense, and we're not going to support it anymore.
But we also know that kids don't just, when they get COVID, it doesn't just stay with the kids, that they spread it to their families as well. Like, my question to you is, how many annual COVID deaths are we okay with? What is a number for an acceptable number of annual COVID deaths and long COVID cases? It's a hard question to answer, and maybe
zero is the only acceptable, but we can't do that.
But that's the thing, Robbie. Like, I feel like sometimes the way we talk about this elides what Walker is saying. So for example, if we had numbers, if we had information that said, everybody masked, you could cut the number in half, or if everyone vaccinated, you could cut the number by 2/3, or whatever it is, a substantial chunk taken out of it, would you not be in favor of those kinds of policies?
It would depend on the policy. Yeah. If I have a general mandatory vaccine, I still think you need Congress to pass it rather than like President Biden declaring it. We should actually have to do the process of making new laws in this country. But yeah, if it had a cut the deaths of COVID in half, that would be a very strong argument for doing that policy. Sure, but I don't think we're anywhere. The spread is what the spread is. We can have some impact on it, but it's just, this is going back to Leanna Wen's point. We're beyond We're beyond the ability to do wholesale control of the transmission of this virus. We're not beyond the ability to impact the severe bad disease outcomes. We can do more to prevent that.
Well, but
Yeah, go ahead.
but because of long COVID and its prevalence, which is anywhere from 10% of cases to 30% of cases, and some estimates are even higher.
We have no idea what that even is.
But we do know what that is. We do know what long COVID does to people. We see it. We know that it leads that it includes blood clotting. It includes damage to your heart. It includes damage to your kidneys. It includes shortness of breath, brain fog. We do know what long COVID does. We are, and we're narrowing in on what causes it. And when we get there, perhaps then this discussion can be different. But in terms of like, oh, we can take certain measures, but we are good against severe outcomes. So that's not entirely true because of long COVID. And the only way to really prevent long COVID right now is to stop the spread of this virus. So, and we know that mask mandates, we can. In fact, there was a recent study that just came out this month about mask mandates in schools in Massachusetts, and it found that the schools that removed their mask mandates saw greater spread than those that did not. I mean, it's
we talked about that on Rising.
Yeah.
And so Robbie,
probably with no statistical difference in deaths or severe disease whatsoever, but
here's the thing, Robbie. I am with you. I have been persuaded by some of what comes out on the show from you and the things that Kim has argued in the past. I was not as aware of the diminished efficacy with respect to transmission in the, and how that kind of affects some of these policy debates as I am now that I've been having these conversations with you in the show. Like, I'm not inflexible on these things, but I have a really hard time with how that information is being in some ways exploited. And I think in ways that let the administration off the hook from doing what it could. So you're saying, like, we can't stop the spread. We're all going to have to live with it. It is what it is. If we lived in a world where we had a really full-throated maximalist approach to stopping COVID and it still didn't work, I might credit that a little bit more. But in a world where schools do not have ventilation systems, other public spaces do not have ventilation systems implemented, we do not have testing, we do not have vaccines made widely available. Why isn't there like a vaccination station set up in front of every school as people go in? We talked on Rising and there was a lot of like jokes made about how liberals wanted all these child vaccines. And then when the child vaccinations became available, nobody vaccinated their child. LOL, libs, you're owned. Okay, well, I would like to see a world if we agree that it's good for kids to get vaccinated, because even if it's only marginal cases where they have the worst outcomes, why not prevent those marginal cases? Why not prevent these pediatric units from getting overwhelmed and set up? Why isn't Biden setting up these vaccination facilities in front of schools so kids and parents and everybody can go ahead and just get boosted as they drop their kid off at the beginning of the year? I mean, there are all of these conversations we are not having about interventions that could be in place, because there's either two camps. You're either in the camp, nothing can be done, oh well, which is a very, I gotta say, privileged camp to be in if you're someone who can work from home and someone who is young and healthy and all of these other kinds of things. Like, I don't know that it's fair for you to take that position. It's a little selfish. Or the other camp, which is characterized as you want us to shut down the whole of society forever without any care for the consequences on a kid's ability to learn or socialize and things like that.
I also just want to point out that when you say we can't, nothing can really stop this virus, that's not what the international viewpoint does show that countries that implemented, you can't say these words in America anymore, but zero COVID plans, that those countries were able to cut their death rates significantly compared to us. I mean, we've been hit harder than any other wealthy nation on earth, and that's because we've just decided to let this virus rip, which is.
What do you make of that, Robbie? Like, when you hear that, when you see that there are other countries who have taken different approaches and who have had fewer deaths, does that not weigh on you or militate in favor of doing something differently here?
Well, some of our peer countries in Europe have had less strict masking policies for kids, or less vaccine requirements, or been less likely to either force or even recommend vaccines even for teenagers. So there's been a variety of different approaches taken. I don't know exactly why we had a worse time of it. Yeah, there certainly is more vaccine hesitancy is part of a political ideology that I think is bad and resulted in a lot of unnecessary death and suffering. I'm totally against that. I've spoken against, that level of sort of anti-vax behavior from people who are old or who are ill, and who should certainly get the vaccine, especially if they hadn't had COVID before. That's something I talked to Rand Paul about on the show, or in one of the interview I did. He said, yeah, I would absolutely advocate it for, if I was having a conversation with someone who was, older than 50 and had not had it, could take an antibody test and hadn't had it yet, I would absolutely tell them it is in their best interest. I would try to persuade them to get vaccinated. And I think that was bad for our country. We might be more unhealthy. We might have more obesity, those kinds of things. You're right that countries island nations and countries that are far more politically repressive, like China, yes, had vastly better COVID outcomes. I am utterly unwilling. I think most people are unwilling to live in a society of widespread political rights abuses, human rights abuses, genocide.
Well,
I hate to tell you, I hate to say this, but Robbie,
you already live in one.
You do. Yeah. I mean, what's it like?
Not anything on a. It's just.
But let's not have the China. Let's not have the China conversation. Let's not do that.
Okay, but for the audience, no, I criticize the U.S. government for and for many of the same things you do on the show all the time, for our foreign policy. I have routinely described our government as overly repressive, and not just on right libertarian grounds, but on some of the things you care about too.
I apologize for bringing it up. You don't have to explain. I couldn't resist.
We joke, we kid. But Walker, can you be specific? I mean, are there countries that are not China that you can point to and draw a straight line between their COVID interventions and their lower death rate?
Of course. I mean, New Zealand is one.
But that's not an island nation, because I think Robbie's point about the islands being able to shut it down better is
sure.
fair.
Yes, it's true that island nations have an easier time shutting things down, especially if you limit international travel. But there is a sort of a middle ground, right, between the response China has had and the sort of like everything goes, let it rip response we've had. Like we don't have to have hard lockdowns where people are confined to their homes. We never had those in the US, by the way. But we don't have to have that kind of policy if we have things like air quality standards in workplaces and schools, masking, people are getting vaccinated. If there's paid leave, if we have a single payer healthcare system that, but vaccine hesitancy, by the way, a lot of that is because people just don't have doctors. People can't go to doctors. You're a lot more skeptical of the medicine if you don't have access to it.
The CDC's recommendations for masks for children were stricter than the World Health Organization's and the European Union. It's that we masked more aggressively. We recommended masks more aggressively than European health authorities did.
I don't think that's a bad thing, but I think that it's sort of besides the point that I'm making, which is that if we have these things in place, we can have less disruption. Like they're letting this virus go and saying we can't do anything. This is a novel virus. It is mutating rapidly. The long-term effects are coming into focus. It is quite dangerous. And by the way, for child deaths, we always say, oh, well, they're not really at risk because only like 1,400 kids have died. But for some context for that, in 2018, only 19,000 kids died in the entire U.S. So just because like kids don't die very frequently as a demographic. So something that kills like 10% of kids or 10% of child makes up 10% of child deaths in America, that's something you still take seriously. But we should have basic protections for people in their workplaces. We should make remote work. We should normalize remote work and make remote options available for school. Immunocompromised people are being asked to do this forever. to live with this choice of participation and possible death or starvation. We are asking them, by doing nothing, to live this reality forever. And I don't think that's fair.
Well, let me ask you quickly then, just as we wrap up here, Robbie, are you worried about mutations and that you might be advocating for kind of a policy stance that might not hold up to whatever comes down the pike, especially as we are heading into the winter?
No, because I don't. Again, to the extent we're talking about masks and other things, we have a fundamental disagreement, on how much that is actually doing to hold back transmission. I am totally in favor of vaccination, research into more vaccination, better
Robbie,
vaccines.
you don't doubt. Wait a minute. You don't actually doubt the efficacy of KN95 and N95 masks. You're frustrated that there wasn't more clarity about which masks are more effective than other masks, but you're not disputing the data on how masks, when actually used, prevent transmission, right?
I think that they reduce transmission. I think there's something of a question for how much good they are actually doing to hold back cases.
Well, okay. I mean, I think Walker pointing to the study about school transmission and masks in Massachusetts is useful. I know that you have other studies and it's all over the place, but the specific studies about the use of masks, not about masks mandates per se, show that the higher quality masks permit transmission at a fairly effective rate, upwards of 80%. Maybe, Walker, you know the exact numbers offhand.
I don't have those.
But they're very, my recollection from the radar was like 85% for the KN95 mask.
It's very high.
So you think wearing a KN95 mask makes you 85% less likely to catch Omicron?
Yeah.
Yes.
All right. We'll see if that holds up.
But we know that it's not just a state, like let me rephrase.
Oh, N95 masks, wait a minute. N95 masks filter up to 95% of particles, 95% of particles in the air when they're properly fit and used.
Yeah, the numbers are out there. It is very, very high. One-way masking is good, but two-way masking is much better. We can cut down the spread of this virus if people just do basic things. It's not it, but this shouldn't be a discussion about.
It protects. It makes you 90% protective. Go do that.
But if you're in a place where nobody else is masking, it reduces.
That is tough. So it prevents 95% of particles, but N95 or KN95, if you wear it in an indoor space with other people, you're 83% less likely to test positive for COVID. So it blocks 95% of particles, and you're 83% less likely to test positive if you're in the room with someone with COVID, which I think is significant. Walker, I would need to see. I mean, the one-way masking point I think is not trivial. People do hear that information and say, "Okay, well, great, your mask is working. Why do I need to wear one?"
Well, because it's not like 95% of particles is not 100% of particles, right? Like if you're in a room that's full of COVID for a significant amount of time, one-way masking is not enough to.
But this is Robbie's point, Walker, that like you could outlaw cars. If you really wanted to prevent all car accidents, exactly. You could go ahead and say we're not going to have cars. But at what point is the marginal gain so marginal that it's not worth doing?
If we get an 85% reduction in the bad thing without forcing anything on anyone, great. Problem solving, I'll go home. Like that's great. But that doesn't require any requirements.
Okay, but like when you create a situation where it's everybody, you can mask. You can choose not to. First of all, you're not effectively communicating the risk of this virus. You're not effectively communicating the danger that this virus poses. Number two, you're going to create behavior where some people mask, most people do not, because they, again, are not effectively being communicated to. And that increases the risk for the people who are masking, because even if you mask, you wash your hands, you do all those surface is not really how this virus spreads. But if you take as much precaution as you can as an individual, it is not enough. This cannot be an individual response. This is a once in a century public health crisis. The response to that has to be collective. It has that's the only effective way we are going to stop this virus. And frankly, it's the only effective way that we're going to be able to do anything about climate change as well. And this, I've said many times, many people have said it. This is a dress rehearsal for how we address the climate crisis going forward. You have to do more than it's up to you. Just do whatever. It's not as protective. It puts vulnerable people at greater risk. And I think it's immoral.
So Walker, here's the final issue. The more we ask of people, I do take Robbie's point that the more we ask of people, it feels like the shorter you can demand it of them. And I worry that, like, my preference would be to move away from making the asks that are so politically fraught and also aren't as tailored to having good outcomes, and making it easier for people to do the right thing by actually just providing things from the government. And so I want to ask you, I mean, if you think that this is something that's not going anywhere anytime soon, which I think is correct, where do you stand on things like shutting down indoor dining, shutting down museums, shutting down all of these kinds of indoor spaces? Well, especially let's stick with indoor dining, because you have to be unmasked. You can keep museums and stuff open and just require people to be masked. But would you say that we should not have indoor dining, even going into the winter?
Yeah, absolutely.
Yeah.
I think that's very basic. I don't think that's a point that many people are willing to sort of make, but I think, yes, absolutely. I agree with you that that our government should be doing things like providing masks to people. I mean, look, these things are not without a price tag, like testing, masking, and all that. There is now a price tag for these things. We should be providing those to people, making it as easy as possible to obtain a mask, to get tested, and whatnot. I quibble with the idea that we should shy away from things that have become politicized, because there has been a deliberate effort to politicize those measures. And I think that I don't think you surrender basic public health measures because these right-wing business-backed groups are politicizing them.
I said
you
politicized and also aren't well calibrated to actually having a significant effect. That's what I'm saying. So for me, the two-way masking, if one-way masking is highly effective and two-way masking, which means a mandate, is going to have the backlash that it does, I don't know that that's worth it if it's going to cause a bunch of people to think of not wearing a mask as a political statement, and then we get less overall masking. Do you know what I mean? But
one-way masking is it's really not as effective, and it still puts vulnerable people at significant risk, because there's going to be more virus in the air. They're going to be more exposed to the virus. I don't think that we can leave people behind for the sake of normalcy for people who feel safe, or people who have good health care, people who are young and healthy. I don't think we do that. That's not the kind of society that I want to live in. I don't think that's the kind of society that anybody on the left should advocate for. We should be an inclusive, this movement has to be inclusive. It has to stand up for people who are, vulnerable. It's just very basic to me.
Well, Walker, it's difficult though, because what do you do about the fact that, we'll see what happens in DC, and it is an outlier case, and I don't want to overstate how common this is, but we are facing schools opening in DC where a significant number of kids are not vaccinated and ostensibly won't be allowed to even attend. And those are, I'm sorry, underrepresented, historically disadvantaged groups, or overrepresented among their number. And I don't like the way that is being kind of like exploited and poked and prodded by people who have an agenda that is not my own.
I believe the mayor said there'd be no remote school for them either. She said, get vaccinated or tough luck.
That's a huge problem. Remote schooling should absolutely be an option everywhere, and schools should be funded enough to make workable remote programs. But
this is what I'm saying, Walker. It's not always, the interests of the left are diffuse and sometimes are competing. And I do think that also these kind of civil liberties concerns shouldn't be completely subsumed under the banner of public health, because that could get really ugly really fast. And so I broadly, I hope you understand, agree with you. And if I could wave a magic wand, everyone would do what I do and we would all be masking and vax and everything like that. But I also have to, we have to live in a society, and sometimes that means calibrating your response in a way that's going to maximize the right outcome, the best outcome, not necessarily force an outcome, like force a policy that might actually cause people to rebel and not actually comply in the ways that would be socially beneficial. And that's what I'm trying to get to the bottom of. I don't know the answer to what the right calibration is. Hey YouTube, thanks for watching. Just a reminder that this is a podcast. You can catch an extra premium episode every Monday for $5 a month at patreon.com/badfaithpodcast. That's patreon.com/badfaithpodcast for $5 a month, an extra episode every week. Additionally, please do consider liking this video, subscribing to this channel. It helps us out. It helps independent media beat the algorithm. We appreciate you. And as always, keep the faith.